everyone, my name is Amanda Wasserman, and I want to be a physician assistant. My journey toward pursuing a career in the healthcare field started at an early age. As a high schooler in northern New Jersey, my passion for health sciences and my drive to one day enter the healthcare field blossomed. But my motivation for my future career changed when I read The Immortal Life of Henrietta Lacks by Rebecca Skloot in 11th grade English class. It's the story behind the HeLa cells, the first successful immortal human cell line. As I turned the pages, I was outraged that Henrietta, a poor black mother of five, was exploited by wealthy, powerful white physicians and researchers. Although I was only 15 years old, I became preoccupied with the injustices of her life and death, and the book's themes of racism, classism, and sexism, which still plague our healthcare system today. It gave me a mission to provide healthcare to those who have little means of accessing and affording it. Through my studies and research, I soon discovered the physician's assistant role would be a perfect career for me. These early lessons motivated my academics and work experiences toward becoming a PA. My demanding coursework in both biological sciences and public health at the University of Michigan enabled me to build my medical knowledge and to explore new perspectives on socioeconomic issues in healthcare. As a sophomore in college, I was accepted into a competitive research program run by Michigan Medicine's Department of Cardiology. During my 2 years there, I worked alongside a team of medical professionals to address health disparities among pulmonary hypertension patients seen in our clinic. I had the incredible opportunity of publishing 4 peer-reviewed abstracts in both the Journal of the American College of Cardiology and the American Heart Association's Quality of Care and Outcomes Research Journal. I even had the honor of presenting my findings at the annual Q-Corps scientific meeting in Washington, D.C. in April of 2018. Most recently, my colleagues and I sent in a manuscript for peer review on the efficacy of epistaxis-related health education programs among patients on anticoagulants in reducing ED visits and hospital admissions. Hopefully, you will be able to read it soon in the Thrombosis Research Journal. This past February, to further develop my skills in clinical practice, I began working as a medical assistant at a primary care office. From taking patient vitals to performing EKGs and x-rays to administering immunizations, I quickly assumed many clinical responsibilities. Yet, as soon as I became comfortable with the daily operations of this fast-paced, multi-office practice, COVID-19 hit hard. Suddenly, I was facing the unexpected stresses of working many long hours during a pandemic. The fear of being infected or infecting others loomed over me. I never expected to encounter such oppressive protective gear, shifting work schedules, or an incredibly high level of panicked patients. However, by focusing on the patients and looking at the situation as a call to duty, I felt a calm resolve to carry on professionally and join in the fight with the rest of my colleagues and healthcare workers around the world. During this time, several of our Detroit branches located in infectious hotspots were forced to close. We worried about this area's vulnerable population that already suffers from poorer health and has less access to local quality care. To fill this gap, our office's PA spearheaded a telemedicine program so he could diagnose and treat inner-city patients remotely and safely. Observing and assisting in telemedicine visits during this unprecedented health crisis and seeing the ways PAs can revolutionize healthcare has further ignited my passion for the profession. Today, I am continuing to work toward my dream of becoming a physician assistant by working at a pediatric ophthalmology practice here in Pittsburgh, Pennsylvania that specializes in strabismus. As an ophthalmic technician, I obtain patient history and chief complaints and perform ophthalmic examinations. Watching our patients leave the office with a smile on their face because they finally have proper eyewear fills me with great pride. However, many of our patients do not have the luxury to be able to afford proper eyewear that will greatly improve their quality of life. It's disheartening and infuriating to watch our healthcare system continue to prevent patients from obtaining the care and treatments that they deserve. Watching these encounters further drives my ambition to provide quality patient-centered care to many, while fighting for healthcare justice for those who lack access to or cannot afford medical care. I am forever grateful to Rebecca Skloot for resurrecting Henrietta's legacy through her novel. It has inspired me to write my own story, and now I'm ready for the next chapter. It's the part where I contribute my unbounded curiosity for health sciences and my experiences in clinical medicine to help expand access to quality healthcare. Down the road, I hope to combine my interest for clinical research and my passion for fighting for healthcare justice and reform by studying the effectiveness of health education programs in underserved communities. My goal is to assess the needs of a community, implement health education programs to fulfill those needs, and analyze the impact of those programs on patient health. By creating research databases, I will be able to capture physiologic data that I can publish in peer-reviewed publications. I, as well as millions of healthcare providers around the world, will then be able to implement this information in our clinical practice and public health workshops that will make healthcare more accessible and affordable and create a healthier population. Thank you to FIGS for this incredible opportunity. I am grateful for your consideration and your commitment to investing in the next generation of healthcare providers. As a future PA student who is already in debt from undergrad and is currently working 2 jobs to pay off these loans before PA school, earning the new ICONS grant will allow me to attend PA school and not have to worry about my expenses. With your help, I will be able to focus on my studies to become an amazing future healthcare provider and researcher and make a difference in patients' lives.